Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is with you. And today we are discussing the situation of healthcare preparedness in Iran during the conflict. It is 14th day. And I have done, this is the fourth video on the Iran situation and what is after 14 days, how the Iran healthcare is dealing with this massive attack from two countries, Israel as well as the USA, and now marine and other heavy arsenals are being used, even cluster bombs, drones, missiles, and some other AI related cyber fear, and even there is a danger of the nuclear uh, war as well as the uh, biological war. So weaponology is coming up in the entire Gulf region, and the consequences are in the form of escalation, in form of economic blockage, as well as the warring nations, their civilian and armed forces uh, are prepared to do whatever the orders are coming. And even the supreme leader of Iran, Ali Khamenei, was martyred, and his son has taken over as a supreme leader. So let us see what is new in the Iran and what is internet and the digital technology. We can understand what is going on. So coming to the next slide, let I should change the slide. These are the contents, and we will have introduction, hospital deliveries, and maternal care during conflict. That is the important aspect I want to deal, and summary of the current Iranian context. So let us move further. What is based on the current geopolitical situation in West Asia, especially in the Iran, it is important to distinguish between preparedness protocol, what is planned, and active war zone realities, what is happening in the place like Gaza or Lebanon. While there have been recent escalation involving Iran, the healthcare system inside Iran has not yet faced the total collapse. That is important, seen in the active conflict zone like Gaza. However, Iran's health infrastructure is heavily prepared for such scenarios due to the past experience, the Iran-Iraq war, and current regional tensions. Uh, so coming to the hospital and deliveries and maternal care during conflict, I think that is the focus of this presentation. In Iran, major hospitals, especially in strategic border areas, are designed with passive defense architecture. But let us understand what is passive defense architecture. Many major hospitals have underground level basement or bunkers that serve as a backup operating rooms and maternity wards. In the event of air strikes, labor and delivery units are moved to these fortified areas to protect against shock waves and structural collapse. So I think that is a new thing, and I have seen even in Liaquat University because there is underground complete basement hospital. If the superstructure or the visible structure is damaged, then the underground wards, hospital, even operation theaters can be operational. This is my experience, and as an MBBS doctor, I have seen these structures, and even in Nowport during the war with India, our tension, I have seen the army hospitals or field hospitals, which are also dug inside the earth, and wards and other movement corridors are developed and tents are installed. Uh, so another is separated wards. Maternity wards are often located in the most protected parts of the hospital, away from potential impact zone due to the vulnerability of the patients, mothers, and newborn. So let us see what is next. Triage and emergency protocol. When an attack is imminent or occurring, hospital active code orange or similar disaster protocol. So they have a code. Obstetric emergency are given high priority if a hospital is damaged. Pregnant women in active labor are the first to be transferred to backup facility that is underground. Hospital conduct regular drills for evacuating incubators and delivery beds. You can understand that even they are in the drill phase, and the incubators and the delivery beds are brought to the upper side, then to the underground side. In the event of structural damage to a maternity ward, patients are moved to pre-designed backup hospital identified by the Ministry of Health. So I think that is a great lesson. Alternative birthing centers, if main hospitals are damaged or overwhelmed by trauma, casualties, war wounded, the healthcare system shifts to the decentralized care. So that is, I think, a great lesson that you can have three, four layers, particularly for field hospital, the Iranian Red Crescent and military medical units deploy field hospitals. While these are usually for trauma specific, tents or zones are allocated for obstetrics. Primary health care center Iran has an extensive network of the local health houses and clinics. During conflicts, low-risk deliveries are diverted to these smaller local centers to keep the main hospital free for critical trauma. So health houses, just like in LHW in Pakistan, they are also supporting this kind of. Then handling deliveries during active fire, the Gaza Lebanon model. If the situation in Iran were to be deteriorated to the level of intense urban warfare seen recently in the region, where hospitals are directly hit or surrounded, the handling of deliveries become much more dire. Makeshift operating theater doctors perform C-section in corridors or basement using flashlights if power is cut. Lack of anesthesia in severe siege conditions, emergency C-section may be performed with limited or no anesthesia to save the mother and child before a building collapse or a raid is done. As unassisted birth, if roads are blocked by rebels, women often give birth at home with the guidance of midwives over the phone or ambulance cannot reach them. So you can understand how they are dealing with the most important, sensitive, life-saving healthcare in Iran. Psychological and medical complications, war condition drastically change the medical management of the births. Premature birth, the stress of bombing and attack triggers a spike in premature labor. Doctors often administer corticosteroids to accelerate fetal lung development as a precaution for all pregnant women admitted during alerts. So you can understand that doctors often administer corticosteroids to accelerate fetal lung development. I think that is a great lesson for the doctors in Pakistan as well as in other countries who are facing such problems. Uh, Power outage incubators for premature babies rely on generators. If hospitals are damaged and generators fail, medical staff must manually ventilate newborns using bagged valve masks. So look at how the alternate is working. So now we are reaching to the summary. Uh, as of late 2024, while Iran has exchanged fire with adversaries, the damage to its domestic hospital has been minimal compared to the devastation in Gaza or southern Lebanon. Iran recently utilizes a surge capacity model. It keeps its maternity wards functioning normally but retains the ability to move them underground or to alternate sites within hours if a dire threat to the land healthcare infrastructure emerges. So, thank you. I think this insight has given us a new look into the healthcare strong system. It is not only dealing with the wounds, injuries, and polytrauma, but safely dealing with the maternity crisis. Even roads are blocked, light is not there, hospitals are damaged, underground facilities become operational. If underground facilities are not reachable, then health houses they become the part of the delivery system. And even anesthesia is not there. The C-section is done, and even some emergency medicine like corticosteroids are used in case of eye emergency so that the premature births and abortions are not done and the lungs of the child are developed fast with corticosteroid use. I think these insights will help our GPs and the neighboring and Gulf countries. And I am just discovering these things because most of the war-like situation or war medicine is not in our curriculum. Even in 17th century, armed forces established their own schools, and almost 700 more curriculum teaching is towards the war problems. Thank you very much. Dr. Hussain Bashkulaji is with you. And hopefully, I think this video will give you, and we have dealt particularly the MCH care during the war is the main topic. And please like it, share it, and tell me where from you are listening, your city, your country, and forward it. And I wish all the doctors in the Gulf and in the Iran perform their duties with utmost professionalism and with a moral and overall high moral good of their duties and wish them safe and a peaceful solution of the West Asia war. Thank you very much.